Good morning, Central Texas. Welcome to Kids Community Connections at mykids1031.com. I'm Phyllis Jones, your host this morning. And you know what? I'll say for the last time this year, I'm your guest also. Because one of those unfortunate things happen. You know how you have 35 loves accidents somehow or another. Anyway, my guest got lost on the way behind me in the accident. So it'll just be me this morning, and we're going to talk. First of all, for your kids, today, Holiday Under the Stars. Today on Sunday, it starts at 3 o'clock at the Killeen Community Center. Bring your kids out because they'll be able to have some free fun, burn off some of that excess energy. There's Santa Claus house. Santa Claus will be there because Santa Claus arrived on Saturday evening. But he'll still be there for the kids to come and talk to. There are going to be some games for kids to play. You're going to have a host of organizations that are there playing games with kids also. So some of the games that win prizes, just have a little fun for the kids. You're going to have vendors there also. So adults, you can, indulge in buying something for the holidays for someone or even just for yourself. But just remember, it's today at 3 o'clock at the Killeen Community Center. The games are free, and all the activities they're going to have going on are free. The only things are not free are what the vendors are selling. Of course, that's not free at all. But anyway, bring your kids out and give them time to run around and all the other stuff, because we know kids have excess energy and we want them to burn it out as much as possible. So allow them to. Also, next Saturday on the 8th of December, we know is a Christmas parade. But what you might not know is they've extended the deadline date. The deadline date will be December 5th. So you can go to the Celebrate Killeen's Facebook page and get more information. Also download the application. This year, they need more people in the parade. This year, for the first time in who knows how long, they don't even have 100 entries into the parade. So if you, sitting around and thinking that it's too late for you to join in on the parade, it's not. You have till December the 5th. So remember that. And you have till noon December 5th. So, fill out the application, get your group, your organization, your club, car, bike, whatever club you have, get them into the parade. Because like I said, then again, it is not too late for them to get in, to be a part. And, kids love parades. They really do. They love it, and it's a lot of fun. To be in a parade, and also for kids to watch the parade. And also remember, those of you that are, have a float or an entry into the parade, you can't not throw candy from your float to the kids that's watching it. What you need to do is, if you have a float or an entry and you're driving, have someone that's walking with your entry, and they can walk over and throw candy into the area where the kids are. And that's the adults too, because I see adults picking up candy. But you can have someone that's walking that can throw some candy over there. And the reason why they don't want people in floats or cars and trucks or whatever your entry is that's driving, they don't want you throwing candy, because if you throw candy and it doesn't go far enough, we know kids, their instinct is get candy first, and they'll run out there and they'll get the candy, and we don't want them to get hit. That's one thing we don't want to happen. So if you are in the parade and you are going to give out candy or whatever you're going to throw to the kids, make sure you have someone that's walking, and let that person go over and throw the candy closer to where the kids are, and so we can make it a safe holiday. And last weekend I talked to you about parking. So I'm going to talk about it again, just a little bit. I'm not going to stay on it. But if you are going to go to the parade, first of all, get there early so you can find a parking space that you want, rather than one you just have to take. If you end up parking close to the railroad tracks, make sure you're not on the railroad tracks or touching the railroad tracks, because you need to remember, train doesn't stop because of the parade. Train stays on schedule. And no matter when our parade, what day our parade is, what year or what date, train always goes through on Saturday at the same time. So just remember that and be safe. But as far as today, take your kids out so they can have some fun, burn some energy, play some games, meet some new people. Your kid might find an organization that is for kids and that they can join and participate. So like I said, let's get out there and make sure your kids have fun. Also, Mel's will be there today to do a live remote, so you can come by and see him. But you know what? The one surprising thing Mel's doesn't know is I'll be there too. I'll be doing the announcement for the entertainment tomorrow. So they don't need two crazy people up there together. But you know what? We're going to have some fun. So you know what? If all else fails, come out and see me and Mel's hanging out. Like I said, I'll be there actually working, doing the announcement for the performers, and Mel's will be there doing a live remote. So come see the kids, come see us. By all means, just come on out, hang out with us and have some fun and burn some energy for your kids. Now for our topic. I don't know if you knew or if anybody knows, but December 1st has been voted as World AIDS Day. You know, and it's pretty bad that we have to have World AIDS Day. You know, it's, I know we have, you know, diabetes month. We have, you know, heart month. We have month for strokes. We have months for all disabilities, but because we need to, because of the heightened number and awareness that needs to be spread. But we have a World AIDS Day. And, you know, that's something we don't want to deal with. And, you know, we talk less about it, but we really do need to talk about it. And so we're going to talk about HIV today, because yesterday was World AIDS Day and today is my show. So we're going to talk about it. And the reason we're going to talk about it because it's still there and it's still on the rise. And, you know, I'm a part of the HIV.gov group, so I get the information from them, and they have a website, and they're talking about the successes, the challenges, and the opportunities. And the opportunities aren't the opportunities to get AIDS. The opportunities are to get the information out there so that we can not make AIDS go away, because we know that we can't do that, but we need to lessen the number of people that contact HIV. So thus we need to understand it, and so that we can help it go away. And you know, it's not going to go away 100%, but we need to lessen the numbers and the age groups that are getting it. So let's talk about the successes. The successes of HIV is that we're reducing right now. The working goal is to reduce the numbers of new infections of HIV by improving health outcomes, by improving information getting out there to people, to also improve and reduce some of the related disparities of HIV. And what I mean the disparities of HIV is, you know, you have a large population of people, you know, getting HIV, and they're getting HIV from so many different ways. You know, people think that the only way you can contact HIV is by having sex with somebody that has it. Well, it's not. It's a bloodborne disease. So we need to remember that it's more than just that. Before this month is out, I'm going to have a friend of mine come on. Her name is Trudy. And Trudy is HIV positive. And she, in 1993, she was given 90 days to live because she did contact HIV from her husband. And it's 2018 and she's still living. So I think she passed the 90-day crisis of HIV. But she did not get HIV from having sexual contact with her husband. Her husband shared a cooker, which means, you know, he was on drugs. But he shared a cooker with someone else, came home to her. And after, yes, having sex with her, she contacted the HIV virus. So she got it that way, but he did not. He got it from, sharing a cooker with someone, and then we find out, then we have people who they're in a situation where they don't know, where the information is not getting to them. So they're still some of our ones that are contracting HIV, and we need to do more testing, we have a car club that does HIV day, testing day, and the people come out and get tested. So we need to do more of those to stop this from spreading, because what we're doing very well is we put it up under the carpet. We're doing that very well. And we need to get the information out there. We need to let people know that some of the tests are free. They can get a free test for having it. And we also need to let people know that are living with HIV, that there are important health benefits to getting their viral medication, free. There's some grants out there. There's some benefits out there for them. But you know what? They don't know about them because some of us haven't let them know. And some people are just not in, in that awareness where they can find things out. They had at one time, told people that were on HIV, like I said, Trudy was given 90 days to live and she's still living, which means some of the medication that is out there now is letting her lead not a normal everyday life, I'll say, but leading a life as much as normal as possible. So she's proof that some people are still living with the disease. Also, we need to stop that, the pre-exposure things that goes on. This pre-exposure of what's going on with HIV, we need to let people know about it. Also, I don't know if everybody knows about it, but there is a pill, and it is a one daily pill that, when taken as prescribed, can protect HIV negative people at a high risk for the infection. And it is PrEP, lowers the risk of sexual transmission of HIV by more than 90%, and the risk of transmission via injection of a drug use by more than 70%. So the name of this drug, I'll spell it, is PROPHYLAXIS. I really can't believe I'm actually talking about this on the radio too, but we need to talk about it. We need to know about it. And also, we know people who need to know. We know people that are in a lifestyle or living a life where, this information is not going to be getting to them. So you know what? We need to be the ones to help share it and help make sure that they get it. Now, some of the challenges right now is, I'll say, despite the progress we've achieved, some populations and regions continue to fall behind. HIV as a stigma continues to be a major barrier to prevention. Testing and treatment in HIV continues to affect certain groups of people more than others. They include men who have sex with men. Ooh, I said that. Yes, I did. And on here, it is saying, according to HIV.gov, it's saying especially young Black and Latino/Hispanic men, people who inject drugs, and transgender women. We must continue to focus on our efforts on these key populations to ensure that they reap the benefits of our new HIV prevention and treatment tools. Those are the people. This is coming from HIV.gov, so it's not nothing that I'm like, oh man, let me just say this today. No, I'm actually reading what they're saying. So these are our challenges right now, and these are the people that we need to reach out to. Not just saying they're the only people we need to reach out to, but according to HIV.gov, these are the people that are our challenges. And it says we also need to ensure that people know about their benefits of getting and keeping undetectable viral loads, and how PrEP can protect them from getting HIV. Right now, too many people, including healthcare providers, don't even know about TASP and PrEP, or they don't realize how lack of access it is to it. These preventions are contributing to the ongoing epidemic. So you know what that means? That means we need to get out and we need to let people know that there are some drugs out there for them. They're new, but we need to let people know that they're out there, because I guarantee you they don't. They don't. So we need to take information. We need to go to HIV.gov and we need to talk about it to other people. Make it, once again, a part of our conversation sometimes. Or we need to host events. A lot of people want to know what to host. Why not host a HIV testing day? Why not, when you do a health fair, at your health fair, include HIV testing at your health fair? Yeah, I'm telling you, at your health fair, provided. Yes. And if you need to know who to contact, Facebook me inbox me and I'll let you know who to contact that will come out and do the testing for free. Yep, I said that. They do the testing free. It's done by the Bell County Health Board, but they do it for free. And it's not, it's secretive. Everybody doesn't know, people know you're getting tested, but no one knows the results. The results are carefully mailed to you, so no one will know. But if we want to know what we need to do, we need to do this because we need to stop it. And we need to make sure that people have the information that they need going forward with this. And it says, since this is a growing epidemic, we need to help spread the word about the benefits of these tools to your family, your friends, your colleague, and healthcare providers. Because remember, they probably don't know. And they don't know just because they don't know. It's not because they don't want to know, just don't know. Now, the opportunities. It says, we are currently in the process of updating the National HIV/AIDS Strategy. So that means we need to do some more work. And the National Viral Hepatitis Action Plan. Both strategies expire in 2020. Did you hear that? They expire in 2020. We need to do something about that. These updates will integrate the latest scientific advances, focus on the most effective clinical practices, and respond to new challenges and services. These updates will help us continue to expand our our hard-won progress and conserve resources and reduce healthcare costs. So we need to do these things, and we need to do them rapidly fast. And we don't need this to expire in the year 2020, because as we know, AIDS won't go away in 2020. So we need to, like I said, do something about it. We need to make sure people are getting tested and they're being taken care of. We need to get that done. We need to talk to people about HIV, about TASP and PrEP. And we need to talk about that in circles that we know that need it. We might need to go into areas that we know where it's highly populated with people who might catch HIV or get HIV. We need to talk to them and we need to help them out, and we need to provide whatever services we need to provide to them so that they will be protected. Also, we just need to learn that it's time to be walking dictionaries again. For a while we assumed, and we did that word assume again, that we didn't need to, talk about it and be about it and all those things like that. We assumed that the information was out there, but when we assume, we're usually wrong. We do know that we're wrong when we assume. Now, bringing it down to Bell County, we want to know what our numbers are. Well, our numbers are extremely high. A lot of people blame our numbers on having a military installation next to us, but we have to count that into our numbers. But our numbers are high for Bell County. Our high numbers are for chlamydia in Bell County, which means we're not doing a very good job. It means that we're not helping enough people. It means that we're just kind of letting things go. Sometimes we get into the mode of it's not affecting me, so why should I talk about it? Well, we need to talk about it because our kids are involved in it. Someone has HIV and they're pregnant, have children. They need to know. Surprisingly, people don't know, but we need to let them know that their children can have it. We need people to realize their children are being born with HIV. So we need to remember that. We need to think about that. We need to act against AIDS is what we need to do, and that's what they're calling it. So we need to do about that. We need to learn about HIV. We need to learn about the drugs that will help stop HIV, and we need to link that information with the community. We need to do that as soon as possible, and we need to do it every time we have a health fair. And I'm going to say it again, every time we have a health fair, we need to do it. And you know what? That means that I need to step up to the plate too, right? Right. So, I will be hosting a health fair for not just HIV, but for HIV and all those other things that, that causes problems, because we have a couple of things that are ongoing and affecting our lives as we have today. So we're going to talk about that along with HIV and do some testing and pass out some information, because the more we do, the more we help and the more the word will get out. And we always talk about it. You know, we did this year, early part of this year, we did a health fair. I did a health fair along with an organization that does it every year. But they included HIV in their health fair. And, you know, it was a bunch of young people there, and they were on their phones, and they were talking on their phones and texting on their phones, and they were all busy, you know, not paying attention to much of what anybody was saying. But then I invited Trudy, and like I said, Trudy has HIV, you know, so when she got up there and she began to speak, the first thing she said was, "I have HIV." Well, suddenly every cell phone dropped in the laps, put away in the purse, put away in the back pocket, and she had everybody's entire face. They were all looking at her. They were glued to Trudy because she said, "I have," not "let's talk about it." She didn't say, "I'm going to give you some stats and some figures." She didn't say anything. She simply said, "I have HIV." And when she said that, like I said, she had everybody's total attention. Young people listening to her that never had listened to anything before, because simply she said it. And if you look at Trudy today, and if you talk to her today, and you hear her on the show, what you will say, she had a stroke. That's all you'll say. That's it. You'll say she had a stroke, unfortunately, and you'll go on, because people are looking for a certain look on your face or a look somewhere, and it's not there. The look isn't there. So one thing you'll say about Trudy, if you see her, is she had a stroke, and that's about it. But when she says what she says, like I say, everybody, the kids all dropped, and they begin to look at her, and they begin to become emotional about her, because like I said, she wasn't talking about stats and figures. She was saying, "I have." And that made a big difference in that. But we need to start talking about it. We need to talk about stopping HIV. We need to talk about putting the checkpoints up there. You know, 1, these drugs will help you prevent it if that's the lifestyle that you're in. You know, 2, we can test you to let you know whether you have it or not. 3, these are the drugs that you can take and the treatments and the benefits you have if you have contacted HIV. So all those things we need to put under our little notes to do, and we need to talk about it. You organizations and your clubs and your groups, you know, as we talk about healthcare for the year, and just about every group does a healthcare event. Just about everybody does. Add HIV testing to your list of what you do, because that's the only way it starts. You know, the part of the CDC's Act Against AIDS initiative, it starts with talking about Stop HIV, which is what it is. Talking Stop HIV seeks to reduce HIV infections amongst gays, bisexuals, and other men who have sex with men by engaging open conversations and discussions. We need people to talk with their partners, and you know, if they're out there just freewheeling out there, they need to talk about it and let people know they are. Also, we need to make sure that when we pass out information, that we pass that out in Spanish as well as English, and any other language that the CDC has. We need to make sure that we do that. Now, unfortunately, and I know people hate being put in groups and stuff like that, but the target audience is gay and bisexual men. That's the target audience. You're asking me why is that the target audience? And, you know, I'm not going to say this is why, but I'll say from HIV.gov, they've done the research. So that's their biggest targeted audience that they're really talking to and talking about. But we need to talk to everybody about it. Everybody needs to know. And we can help stop HIV altogether. We can stop the misinformation from getting out there. We can stop with people not knowing what's out there and available for them. But that's something that we have to pick up, that challenge, and do. We need to pick up that, and we need to do it and make sure that, like I said, our kids are not affected by it. That's one group that I know we do not want to get it, is our children. And we need to get it right. You know, we need to act against AIDS. We need to treat it like it really is. It's a violent disease, and we need to treat it like that. We want to get rid of violence. Well, HIV is violent. It takes over your system. You know, I'm not going to say you're going to live a long, healthy life like Trudy's been living for a long time. Some people, you know, it takes their life, much like other diseases. You know, people, I learned that they have a bad heart, but they still go do what they need to. They do what they want to do, and it ends up taking them over. You have people that have diabetes, you know, and told this is what you need to eat, and they go out and I'm eat what I want to eat, and we know what happened to them. Well, HIV is the same way. We need to, well, if you contact it, if we contract it, do what we need to do. But since we know how you get it, since we do know, just like every other disease, we know how we get it. And I'll say some of them we do. Some of them are, you know, embedded in your DNA, so you're going to get them anyway. But a lot of the illnesses we have are because we did it. We actually did it. So HIV is one of those, and we need to fight against it. We need to focus on raising awareness of it. We need to focus on reducing the risk of infections amongst our hard-hit populations. And once again, they're listing the populations as gays, bisexual men, African Americans, Latinos, and other communities that have a high increase risk of catching HIV. So yes, yesterday was the World HIV Day, but we need to continue the teaching of it past yesterday, you know, past December 1st. December 1st does not need to be, okay, we talked about it, okay, that's it, let's move on. No. We don't need to. We need to. What we need to do is get rid of having HIV Day. We need to get rid of that. And like I said, the only way to get rid of it is to make yourself more aligned with what's going on with it. To make yourself more aware of what happens when we get it, and also to remember Bell County. Somehow or another, lately we're always in one of those running top areas for HIV, and we need to stop that. And the only way we can stop it, once again, is through education and information. I'm going to take a break and come back.